Good afternoon. Thank you for joining us today. I want to start with the usual statistical update in relation to COVID-19. As at 9 o'clock this morning, there have been 12,437 positive cases confirmed, which is an increase of 171 since yesterday. A total of 1,656 patients are currently in hospital with either confirmed or suspected COVID-19. That is a decrease of 64 since yesterday. A total of 104 people last night were in intensive care with confirmed or suspected COVID-19, and that is an increase of 5 since yesterday. I can also confirm that since the 5th of March, 2,847 patients who had tested positive and been hospitalised for the virus have now been able to leave hospital, and that, of course, is positive news. Sadly, though, in the past 24 hours, 44 deaths have been registered of patients who had been confirmed through a test as having the virus, which takes the total number of deaths under that measurement to 1,620. Now, as I always say, we must never ever think of these numbers as just statistics. They represent individuals whose loss is a source of sorrow to many. And I again want to send my deepest condolences to everyone who has lost a loved one to this virus. We are all thinking of you. I also want to again thank our health and care workers for the extraordinary work that you continue to do for us in the most challenging and difficult of circumstances. Now, I have one substantive issue that I want to discuss today, and forgive me if I do so at slightly greater length than normal. But this follows my update yesterday on our plans for test, trace and isolate. Today, I want to set out for you our latest data on the level of infection and the important R number that you have heard us talk about before. And I also want to describe the work we are doing now to prepare for careful and gradual changes to the lockdown restrictions, but I must stress only when we judge it is safe to make them, which I am afraid is not right now. Now, you'll find more detail of what I'm about to cover today in a new document that we have just published on the gov.scot website. It updates the one we published a couple of weeks ago, and again, I'm asking you please to have a look at that. I also want to encourage you to use the new online tool that we're launching today, which gives you the chance to offer ideas on how we should move forward. I've said before, but it is worth repeating, that the decisions on how we come out of lockdown will affect each and every one of us, perhaps for some considerable time to come. And so I'm determined that I and the Scottish Government make those decisions as openly and as collaboratively as we possibly can. Now, as I said yesterday, by Thursday this week, we have to formally assess whether any lockdown restrictions should be lifted at this stage. The other UK governments will also be making an assessment on or around that date. As we move forward, we will continue to discuss and where appropriate reach decisions on a four nations UK basis. It remains my intention to have UK-wide alignment where the evidence supports it, though obviously my overarching responsibility is to reach evidence-based decisions that are right for Scotland. As I indicated yesterday, I think it is highly unlikely that the Scottish Government will be able to make any significant changes to the current restrictions on Thursday. And I think it's important that I am frank with you about that now. Today's paper sets out in detail the data that underpins that conclusion. In short, we are seeing progress, real progress, particularly in the number of people admitted to intensive care, but that progress is still fragile. That means any increase in the physical interactions we have with other people could quickly see transmission of the virus increase again. We estimate that there are currently around 26,000 people with COVID-19 in Scotland. I stress these are estimates, but that is still too high a number for us to consider that the virus is under control. I've also spoken before about the vital importance, the critical importance of keeping the R number below 1. Now, we know the R number is higher in care homes, but our best estimate is that the R number in the community is currently between 0.7 and 1, but we cannot be sure that it's not closer to 1 than 0.7. There's also some evidence that the R number in Scotland might be slightly higher at this point than in the rest of the UK, although the modelling that is based on is subject to a high degree of uncertainty. But in any event, the R number is not yet far enough below 1 to be confident that any changes to current restrictions wouldn't quickly send it over 1 again. And if that happened, the virus would start to increase exponentially again. That could overwhelm our health service, force us to reimpose restrictions, and it would lead to many more deaths. Now, as an illustration of this, we include in the paper a chart which is based on recent Danish data, and we are looking at experiences in other countries all the time. But what this chart suggests that if we were to fully reopen nurseries and primary schools now, the most likely scenario would be a resurgence in the virus that would overwhelm our hospital capacity in a matter of weeks. Now, the fact is that any easing of restrictions, whenever we introduce them, will have an impact on the R number. But if we get our baseline lower than it is now, we will have more headroom to cope with that and be able to avoid outcomes like the one I've just highlighted. So the hard fact is we must see further restrictions in new cases, hospital and ICU admissions, and deaths to be sure that the overall level of infection and the R number are lower than they are now. And that means for the moment, we do need to stick with the current lockdown restrictions. However, I am acutely aware that the severity of restrictions we are living under now cannot continue indefinitely. We know that lockdown is doing its own damage. So we also need to be preparing to make changes as soon as it is safe to do so. The next 3-week period of lockdown after this Thursday, the 7th of May, is due to end on the 28th of May. Now, let me stress, that doesn't necessarily mean we can't make any changes before then if the evidence suggests it's safe to do so. If we can, we will. For example, I'm particularly keen as soon as possible, for the sake of mental health and well-being, to enable people to be outdoors more. And obviously, we are all keen to get the economy moving again as soon as we can. So today's paper sets out some options that we are working on, both in terms of assessing their impact and on the practicalities of implementation, so that we will be ready to make changes when the evidence tells us that it is safe to do so. Now, to be clear with you, because I have to make sure I'm setting this out clearly, this is not a list of things we will definitely do by certain dates. Indeed, we might not be able to take all of these steps even at the end of May. This is going to be a long process with different phases along the way. And we will only implement these changes when we are as certain as possible that it's safe to do so, and when we can also assure you of that. In the meantime, it's vital that we stick rigorously to the current rules. But as I said a moment ago, it is important that we are preparing now. So I want to briefly set out the options that we are working on, though again, I must stress that none of these are changes we are implementing as of right now. But we are considering, firstly, if and how we could safely change our advice on spending time outdoors to allow exercise outside to happen more than once a day, so long as we continue to stay apart from people outside our own households. But second, we're also considering if a slight relaxation in the rules to allow meeting up with a small defined group of people from other households in a sort of bubble might be possible, even if initially that was only possible out of doors and not indoors. This is, of course, one way in which we could start to interact a bit more with family or friends, which I know is so important to all of us. However, we also have to consider carefully the impact on the spread of the virus, and we have to think through how such an approach could be implemented in practice, and also how the limitations of it could be enforced if necessary. It's also not something that would be possible for those who are currently shielding, so we have to think also about the fairness of it. The third area we are looking at is when and in what order we can resume some NHS and community care services. As you know, we stopped some services, for example, screening programmes and non-urgent elective procedures, to ensure that the NHS could cope with the virus. But these postponements also have implications for health, so we must consider how services can be restarted as soon as possible, and that is what we are currently doing. The fourth area relates to how we carefully, gradually and safely allow businesses to reopen. That is a major area of work for obvious reasons. We need to work with business and with trade unions to consider the practical arrangements for different work environments to start up safely. That's changes to working practices, physical layouts of workplaces, the appropriate use of PPE and the operation of public transport. On this, we're looking carefully at the work the UK government is doing and consulting our own stakeholders on that. Initially, we're giving particular consideration to businesses in the construction, retail and manufacturing sectors, and also to some outdoor and rural businesses. However, where home working is possible, we are very likely to insist on that for the foreseeable future. And I want to be very clear that as of now, current guidance to business remains in place. Finally, I said before that one of the hardest decisions I've ever taken was the closure of schools. I know the impact this is having on young people, and I want to thank all of you watching today again for your patience. And it also has a big impact on family routine. The Deputy First Minister is chairing the Education Recovery Group, which is considering options for how pupils might gradually return to school. Now again, I need to be clear, a return to school might not be possible at all this side of the summer holidays, but we are considering whether some groups of students, such as vulnerable children, children who are making the transition from primary to secondary school or who are studying for national qualifications, could return to school ahead of others. And any initial return to school, when it does happen, is of course likely to require a mixture of time in school and learning at home. For example, it's possible that different groups could attend school part-time in blocks of a few days or a week at a time to enable physical distancing and deep cleaning of schools between sessions. In all of this, we're trying to find the right balance between children's educational and wider needs and public health imperatives. But I want to be crystal clear that while we will of course take the greatest care in all of this, that is particularly the case with schools. We will not compromise the safety of your children. Now, as you will understand from the detail I've just given, and more so if you read the paper that we've published today, none of these decisions are easy. There are no absolute certainties in any of this, and complex judgments will have to be made. As I've said before, lifting the lockdown will not be like flicking a switch. It will be a gradual process which will happen in phases. What we're seeking to do is find a path to a new normal, one which is less restrictive than the current lockdown, but which doesn't risk the virus running rampant again. Now, we've not yet put definite dates on any of what I've just set out, but I will update you on an ongoing basis in the days ahead as our evidence, assessments and planning develops. And as soon as we can start to attach even tentative dates, we will do that. In parallel, we will continue to build the test, trace, isolate capacity that I spoke about yesterday. But let me end on this point. The most important task for all of us in the here and now is to get the virus under more control than it is right now. And I cannot stress that enough. We really are at a critical stage. And what I've set out today about our assessment of the R number in particular, it tells us how critical this stage is and also how easy it would be to go in the wrong direction. So that means asking you again to stick rigorously to the current rules. It means asking you to think hard about your own compliance and tightening that, if anything now, not easing up on it. If you have been going out a bit more than you should, please rectify that. Please stay at home except for essential purposes. And remember, at this stage, essential purposes means only essential food supplies, medicines and daily exercise. And you should ask yourself if, for example, going for a drive-through coffee is really an essential journey. Stay 2 metres from others when you have to be out. Don't meet up with people from other households. Isolate completely if you or anyone else in your household has symptoms. Wash your hands regularly and wear a face covering if you are in an enclosed space with other people. like a shop or public transport. All of this is tough. It is really tough, and I know and understand that. But I want to stress again, right now we are going in the right direction. If we keep doing all of the right things, we will keep going in the right direction and we will get there. Our light at the end of the tunnel that I keep talking about will get brighter as the days go on, and we will find a way through. So please keep doing the right things, and thank you for everything that you are doing to comply. Now, I'm going to hand over to the Chief Medical Officer, who's going to say a few more words about the evidence that is before us before I open up to questions.
Thank you, First Minister. As we've just heard, there continues to be encouraging signs that the rate of infection and the number of cases of COVID-19 in Scotland are going in the right direction. But I want to emphasise once again that we're not yet at the stage where we can relax and assume it's safe to begin to change these restrictions that all of us are experiencing. I want to remind everyone that they remain necessary, and that through all of us working together, we're reducing the ability of this virus to be able to spread. This nasty little virus spreads all too easily, and it preys on those who are the most vulnerable across our communities. We don't have a treatment for it, and we don't yet have a vaccine. And because our population has never encountered it before, it's primed to spread easily and readily when we come into close contact with others who do have it. The First Minister has spoken today about the R number. This is the number of people who would be infected by one individual, and it varies during an epidemic. It's now substantially lower than a few weeks ago. It's probably reduced by up to 80%, but we can't say with confidence that it's low enough to begin changing significantly some of the restrictions that are in place. Neither can we say that there are yet few enough new cases of COVID-19 emerging to be confident that any change will not simply lead us back to that exponential levels of growth that we saw before. The lower we get this number, the more confident that we can be that this will not happen. My advisory group, which is chaired by Professor Andrew Morris, continues to provide very valuable interpretation of the evidence and the modelling so that Scottish ministers receive advice on applying the relevant science that shapes our approach. I'm very grateful to all the members of this advisory group for the long hours, the expertise and the commitment that they're contributing just now. After very careful discussion with them, I support their collective view that there is insufficient evidence to allow confidence in recommending any significant changes to the restrictions at this time. We've come a long way in a short time though, but it's too soon to be confident that changing our approach is safe and won't lead us back to the exponential levels of growth that we all fear. So once again, I'm asking for your help on behalf of my colleagues in the NHS and people across the country to remain resolute in continuing with these restrictions so that you limit the physical contact you have with other people and ensure that we don't create new bridges for this virus to spread amongst us. It's by continuing to work together, washing our hands regularly, ensuring that we isolate when we or a member of our household have symptoms, we can reduce the impact that this virus is having on our communities.
Thanks very much, Gregor. I should have said at the outset, the Health Secretary is not with us today because she's due to answer a question in the Scottish Parliament shortly. I'm now going to move straight to questions and ask Lisa Summers of the BBC to ask the first one.
First Minister, you said that you want to see sustained evidence that the R number is below 1. How long do you want it to be like that before you can feel confident to lift restrictions? And I think when people look at this framework that you've published, one of the most concerning things will be about a return to school. You say you don't expect schools to fully reopen in the foreseeable future or partially in the near future. Can you give any sense to parents about what schooling is going to look like over the next academic year?
Well, what we're trying to do in this paper, and what I've tried to do today, is start to give us a shape and a sense of the options we are looking at. So we're specifically looking at the options of certain year groups going back ahead of others. And as I said in my opening remarks, that would be year groups who are at transition points in their education or who are studying for exams, or having different groups go back for different chunks of the week. I suppose what you take from that is that we need to configure schools in a way that allows more social distancing between pupils, recognising, of course, that particularly with younger children, that is very difficult, and also allowing, and this will be similar in a lot of workplaces, regular deep cleaning of the surfaces that young people are on or learning on in their classrooms. In terms of the definite dates, I want nothing more than to stand up here and give firm dates. I can't do that right now in a way that I would be confident is safe, and that in a way that I can tell you is safe. But what I am going to do, and we started this with the first paper, we are updating that today. As soon as our evidence develops and our planning develops, we will put more detail with more definite milestones around this, and I will share that as openly as possible. In answer to the question, how low does it have to go? That's for experts to advise me. I wish I could say, here's a number for 2 weeks and then we'd know we were out of danger. Experts look at all of the different indicators, all of the different data, and make judgments about the rate that our number is at, how sustainable that is, and then what the impact of different changes would be on that. One key point is whenever, for example, whenever we open schools, there will be an impact on the R number, and that will always be the same impact on the R number. But if that's happening on an R number that's at 0.2, then it doesn't take you into the danger zone as quickly as if you apply that to an R number that's at 0.8, where very quickly it would get over 1 again. So these are difficult judgments. We're seeking to learn from different countries. The Danish data that I referred to today, when Danish schools started to go back, there was an increase in the R number. If we applied that to our situation right now, that would lead to a potential resurgence that would overwhelm our hospital capacity. In a couple of weeks from now, that might be different because we might have delivered and achieved that greater headroom. Other countries, Ireland, for example, has indicated that schools won't be back before September. So we're looking and learning as much as we can, but fundamentally we've got to base these decisions on what the evidence in Scotland is telling us, and that is what we will continue to try to do. Ewan Petrie from STV News.
Could clarify for us, I wonder if you could clarify for us what the position is for businesses where social distancing just isn't an option, for example, hairdressers, beauticians. What circumstances would have to be in place for them before they can reopen?
Well, we're looking, this has to be worked through very carefully. It has to be worked through in consultation with businesses themselves, but also with trade unions and workers who have to be confident that they can go back to work safely when we're asking them to go back to work. So where you're working from home right now and your job makes it possible for you to work from home, it is likely we're going to ask you to do that for quite some considerable time. Where safe social distancing can be applied in a workplace, then those are the options we will be looking at. Where the appropriate use of PPE might be possible, where social distancing is not as possible, to use your example of hairdressers, not to pick on them in particular just because you mentioned it, all of these things will have to be worked through. And then, of course, and we're hearing much of this discussion around the work that the UK government's been doing on workplace guidance. There are then issues we have to work through about what we are expecting of individual businesses in terms of any legal requirements that they will be under, and how can workers make sure that they are properly protected. So these are complex issues, and what I'm saying now is that we might not be able to make any of these changes now, but if we do the practical detailed work now, and that's what we're intending to do, then when the evidence tells us that we could make some changes, we'll be in a much stronger position to do that more quickly than would otherwise be the case. James Matthews from Sky.
Thanks very much, First Minister. Your document published today speaks of the estimated R number in Scotland being higher than elsewhere in the UK. Why would that be? And it also says the R number in care homes and hospitals is higher than in the community, and it is of critical concern. What is that R number?
I'm not able to give you a definite number for that. That is something our advisors and modellers continue to look at. I think I can say with certainty that our number in care homes will still be above 1, but that doesn't mean it will be above 1 in all care homes. There are still care homes where there is no infection. About half of our care homes have never yet had an infection. So that is an issue that not just in Scotland but globally we experts are looking much more carefully at, and the similar is true with infection transmission in hospitals. In terms of why the R number would be slightly higher in Scotland, I should say there's a high degree of uncertainty and lack of precision around this modelling. But if it was the case, it would likely be mainly because we are at a slightly different stage of the infection curve. Our first cases were identified later than certainly in England, so we are possibly still at an earlier stage of that curve than other parts of the UK. So we can't be certain about that, but it is obviously a factor we have to be mindful of and continue to keep a close eye on. Do you want to say any more about that?
I mean, very simply, there's lots of things that cause that R number to vary, and even at its most basic level, the number of people that you have who are susceptible in a population causes that R number to vary as well. So if you look at the kind of UK picture as a whole, the real seat of the epidemic within the UK in the early stages was in London, when many people developed the disease very, very rapidly, very, very quickly. So those numbers rose very quickly. But what that also does is it means there's less people who are susceptible in the population to contracting that virus again. And of course that influences the R number as well. So there's all sorts of things that are at play here, from, as I say, the proportion of the country that's susceptible, to the compliance with the measures, to the stage of the epidemic that we are, and all these things act together to produce those different rates regionally across the country.
Thanks. Sarah Smith from BBC Network.
Thank you, First Minister. The UK government has not shared any ideas like this publicly, but you do say you want to stick to four nations alignment where you can. Can you tell us, are these the kind of ideas that the UK government and other devolved administrations are actively considering? They're just not discussing them.
I imagine all governments across the UK are looking at these kinds of options. We see countries all over the world looking at, and in some cases beginning to implement some of these options. So we're all dealing with the same challenge, and we're all looking, broadly speaking, at the same routes out of this challenge. There will be further Four Nations discussions, I think, over the course of this week. I don't know what the Prime Minister is planning to announce this weekend. I don't yet know that. Given the nature of this, it is very possible that he is not in a position yet to decide that. I want to be very clear about how we proceed. I want to come out of lockdown in a way and at a pace that is the right way to suppress this virus and minimise the harm that the virus does. And if that means doing it in the same pace as the rest of the UK, that's what we should do. But if it means because of variations in the R number or infection rates, we do that at a different pace in some respects in Scotland, then that's what we should do. If it means doing it at slightly different paces within Scotland, that's what we should do. The only thing that should drive us here, and the only thing that will drive the Scottish Government, is what matters to get this virus under control and keep it under control as we start to restore normality to our lives. Tim Burkshaw from ITV Border.
Thank you, First Minister. I'd just like to pick up on that last answer. The Scottish Secretary has again spoken of the need for Scotland and the rest of the UK to come out of lockdown together. He says the Scottish Government has not made good decisions on extra funding for business and shutting down all building sites. How do you respond to Mr. Jack's comments? And could building sites be the first to come out of lockdown? And if so, do you have any idea when?
I covered this in my initial remarks. Construction is one of the sectors we're looking at initially. The Construction Leadership Group in Scotland, I think the document references this, is doing some work on a possible 5-phase restart plan, which we are very keen to discuss with them in greater detail. So, my answer to this is really the general answer I will give to all of this. We do this in a way and at a pace that is safe and doesn't put more lives at risk. I've been very, very, very determined throughout this, and I remain determined not to engage in partisan politics over this, because I don't think that is helpful to anybody. I am at a loss, though, when I hear people saying either we have to come out of lockdown in lockstep with the UK, come what may, or we have to do it on a Scotland-only basis, come what may, because I think both of those are the wrong starting point, and they start to sound as if you're prioritising politics or ideology over what is right for suppressing the virus and reducing the harm it does to people. And suppressing the virus and reducing the harm is my starting point. It's the only relevant starting point, and then the decisions we take flow from that. And if that takes us to UK-wide pacing and phasing, so be it. If it takes us in a slightly different direction in Scotland, so be that. And that is what will continue to guide me. I mean, as I said to Sarah Smith, I don't yet know, and this, I'm not saying this critically, I don't yet know what the Prime Minister might be thinking of announcing on Sunday, I believe it is. And when I do know that, I will be able to judge in the areas I'm responsible for, based on the evidence I've seen, as to whether that is right for Scotland or not. But to give just one example, and this is obviously a completely devolved area, which is schools. You know, we all read in a Sunday newspaper that in England there may be a plan to reopen all primary schools on the 1st of June. Now, I cannot and should not comment on whether that is appropriate for England, because I'm not privy to all of the evidence that ministers there will be privy to. But I do know, as things stand, although we keep this under constant review, looking at the evidence that I have now, I could not put my hand on my heart and say that I think that would be a safe thing to do in Scotland. So nobody surely is suggesting to me that I should allow schools to open in Scotland when I don't think it is safe to do so, just because there's been a decision elsewhere in the UK to do so. The only consideration here is what is the best thing to do, the safe thing to do, to keep this virus suppressed at the same time as we're trying to get back to as much normality as possible. So this is something I've said before, and I will say it for as often as I need to say it. I will only be driven here by what's best to tackle this virus. Politics, constitutional or otherwise, or ideology don't enter into this for me. And you know, I'm sorry if that doesn't suit some people, but it is absolutely what I'm going to stick to in terms of my own decision making. Peter Smith from ITV News.
Yeah, First Minister. Picking up on something you mentioned there about the coffee shops not being an essential journey, I think there are many people who will be watching this have started to see parts of their own communities gradually reopen on their own, perhaps because there's some grey area in the guidance. Like you say, it's not just coffee shops. We're seeing restaurants, we're seeing bakeries, ice cream parlours reopening, saying that it's perfectly safe because they're implementing social distancing. That's coincided with you mentioning that you're seeing an increase of footfall and cars on the road. I wonder if you could please give some clarity about what the rules mean for these kinds of businesses.
Well, the guidance for these kind of businesses hasn't changed. And that's the clarity that I can give. Now, at the outset of this, we effectively talked about three categories of business. Those that are by law required to be closed right now. So that's pubs and restaurants, for example, non-essential retail. At the other end of that spectrum, businesses that have to stay open because they are essential to keeping food on the table and the lights on and the country running. For businesses in the middle category, we can't cater for every single individual scenario, so we've given very clear guidance, and my message is that guidance hasn't changed. So that is, ask yourself if you are doing something that is material to the well-being of the country. Ask yourself if you think that is the case, can you allow your staff to work at home? If not, can you ensure safe social distancing? And if you can't answer all of these questions with yes, then the advice is still you should not be open at this stage. Now, I understand and I share the frustration. I want to see businesses reopen as quickly as possible. But if we do that prematurely, we risk damaging our progress against the virus that will mean economic restrictions for longer than otherwise would be necessary. And the final thing I would say is, for businesses who might be able to say with some legitimacy that they can secure safe social distancing within their own place of business and operation, if that is encouraging more people to make non-essential journeys, then that is also having an impact. So I know how difficult this is for everybody, and I don't want this to last for a second longer than it has to. But one of the points I made in my opening remarks is that we are at a really critical moment right now where we can either keep making the progress we're making and hopefully quite quickly get to the point where Gregor and I can say the R number is sufficiently low, we are sufficiently confident we can start easing things, or we start to take our foot off the brake and we go in the wrong direction when I'm going to be standing here saying actually things have to remain in lockdown for longer. So please think about these things when you're making your own decisions as individuals and as businesses. If we all right now stick rigorously to this guidance, we will all start to get back to normal much more quickly than would otherwise be the case. Fraser Knight from Global.
First Minister, you touched on Leo Varadkar's plan for lifting lockdown in Ireland. In that, he set very specific dates for each stage of the process. Your paper today is very vague when it comes to that, and you've also admitted that there are many unknown intervals throughout this process. Do you think the Irish Taoiseach has jumped the gun and will regret setting such specific dates? And when you start to put some dates onto your plan, will you be putting them all down at once, or will you be doing that gradually?
Well, we want to get as much detail into this as we can, as quickly as we can. And some we'll get to a stage where that is indicative. Some of what I've set out today is indicative. And we want to do that on an iterative basis as the evidence allows us to make those judgments. I don't call into question any judgments that leaders in different countries are making. I am not privy to the advice that Leo will have over the state of the virus and infection in Ireland, and I am pretty certain, knowing him as I do, that he, as I am, will be making the most careful judgments based on the best evidence that he has got. We are all trying to make really horrendously complicated and uncertain decisions on the basis of the best evidence, applying our best judgment to that. And at times in this, we may decide we want to do something that we have to reverse because the virus decides it's going to operate in a particular way. My kind of guiding principle through all of this is not to stand here and tell you that I've got certainty about things before I do. It is instead at every step of the way to be honest with you about what I do know and what I don't know, and the process of decision making that we're trying to go through to get to the best possible outcomes, and to encourage you to let us know your views on all of this. Some of this will be very clear that the evidence can or can't allow us to do things, but there will be choices at some stage around this. If you know, and I'm going to describe the R number here as if it's a currency that you can spend. It's not, obviously, but to illustrate this, if we've got some headroom in the R number of a couple of decimal points, then it may be that we can ease up one thing or another thing. And at some points, that will be important to know what makes the biggest difference to your quality of life. Would it be better to, spend that in a way that eases up business more quickly, or spend that in a way that allows you to interact with your families more quickly? Now, I'm illustrating here, but the point I'm making is that we have to have a way of making decisions here that is collaborative and allows for you, the public, to tell us what matters most to you in all of this as well. Alan Smith from Birr.
Thank you, First Minister. In regards to schools, you give the assurance to parents that you won't compromise the safety of children. There'll still be parents who will have real concerns and may choose not to send their kids back to schools when they do eventually reopen. So I was just wondering what options would be available to those parents who will continue to have concerns. And the framework talks about the mix of in-school and at-home learning. How involved should parents be in those discussions, and who could have the final decisions over the types of learning that children will have?
Well, obviously schools, teachers, parents are already involved in all of that. Education Scotland will have a key role in that, as will local authorities and government, to make sure that to the extent children are out of school, we're ensuring that there is appropriate learning provision for them. On the first part of your question, I'm acutely aware as a politician that I could say to you today, send your children back to school tomorrow. And I could stand here, I'm not incidentally, but if I was doing that, I could say it's based on the evidence that I have, but if you don't have trust and confidence in that, then you're not necessarily going to do that just because I tell you to. And that goes back to my earlier point. These are really difficult decisions. I, as First Minister, I'm responsible for ultimately making them and being held to account for them, but I have to make them in partnership with all of you if they are to be able to be implemented sensibly. And that's why this, iterative, open discussion is so important, and it will continue to be important. And it may mean that I'm sharing things with you before I've got absolute certainty about them, but I think that is better in these circumstances than not saying anything until I'm able to stand up here and give you pronouncements that you may or may not feel confidence in. Neil Puran from the Press Association.
Thanks, First Minister. The paper released today also talks about expanding the number of people households can meet outside of their immediate households, the bubble. I was wondering what kind of assurances would you need before you could recommend we go ahead with something like this, and how large a bubble would it be? I know in Belgium, for example, they've talked about groups of around 10 people or less, and of course it has to be the same 10 people each time. So I was just wondering if you could expand on that.
Well, I'm not really going to say much more about it than I've already said today, because there's lots of practical things we need to try and work through. It's one of these things that is superficially really attractive, because we're all desperate to get to see our wider families and our friends in a way that we're not able to right now. But it may be superficially attractive, but you don't have to think about it for too long to see the complexities that we just have to work through. How would you enforce that people just stuck to the same number of friends? How would that work in practice? How would you decide what that is? How would you know that people within your bubble weren't also in somebody else's bubble, so breaching that? And what would the overall impact on the spread of the virus be? We'd also have to be clear that people would have to understand some of the implications. Right now, we're saying to you, if anybody in your household has symptoms, you have to isolate for 14 days. So if we broaden the definition of a household to include a wider bubble, then that would apply. You would have to isolate for 14 days if anybody within that wider group got symptoms. So these are just complex things that we have to work through if we're to say with confidence it's possible without risking the virus running out of control again. So I just ask people for patience and understanding on some of this. The margins we are operating in here right now are very fine, and if we make the wrong judgments, we risk setting ourselves back. But take it as read. I know how desperate you all are to give your family members a hug and to see people that you haven't seen for a while. I'm as desperate to do some of that as any of you are, but we have to be careful about how we proceed given the very critical juncture that we're at right now. Do you want to say any more, Gregor, on that stuff?
I think this just illustrates the complexity of the decisions that lie in front of us just now, and that we do need much more information and evidence of the impacts that introducing any of these changes might actually have in terms of the transmission of this virus. And as the First Minister has outlined, the margins are so small just now that I certainly don't have the confidence to be able to say that introducing a measure where we suddenly build more bridges between more people for this virus to spread is the right thing to do at this at the right time. So I think the conversations are important, if only to kind of aid the understanding of the complexity that lies behind it.
Thanks. Christine Lavelle from The Sun.
The paper sets out today that special considerations being given to groups in the higher risk category, like the over 70s. Do you envisage a two-tier approach where this group could stay locked down while the restrictions are eased for others? And sort of what would that mean for a fit and healthy 71-year-old, for instance?
Well, remember right now that there are different sort of rules in place, or certainly guidance in place, I should say, for people in the shielded category, much more strict guidance than for over 70s in general. So I think it's important. Sometimes that is misunderstood. It's not the case that all over 70s have to completely isolate in the same way that the shielded category do. In general, and you'll notice if you go to the bit of the paper, or in fact I think it was in my opening remarks when we talked about this bubble idea, one of the things I mentioned has been something we have to think through is the fairness or potential unfairness of it. If something like that is not possible for people in that shielded category or people who are particularly vulnerable, is it fair to then allow others to do it? Now, the judgment might be yes, it is, because we can't allow the quest for perfection to be the enemy of good progress. But we have to think about these things. None of us want to have a two-tier or a multi-tier society. And the first paper we published, equity and ethics were one of the key principles that we said was very important in that overall decision-making framework. And it's certainly something I am very aware of, that we need to try as far as possible, with of course safety and health being the principal consideration, to move forward as far as we can as one society, and that will continue to be a really important part of our thinking. Simon Johnson from The Telegraph.
Does the facts that or the evidence that the R number is slightly higher here, and the fact that we're maybe slightly earlier in the curve, does that make it more likely that you will diversify in some way from whatever Boris Johnson announces on Sunday? And also, just going back to Jim Matthews' question, your officials have produced a range of estimates for the R number in the community of between 0.7 and 1. Have they produced a similar range for care homes?
They are still looking at care homes, and if we can give greater certainty around that, we will do that. Obviously, the situation in care homes is developing, and as I said earlier on, it's just as what we have here for the community is an average for the whole of Scotland, and it may be different in some parts of Scotland than in others. It will not be the case that it is the same in every care home across the country, which is just an added degree of complexity. And remind me, I've forgotten the first part of your question.
Yeah, basically, does the fact that the R number there's evidence about the R number make it more likely that you're going to diversify and maybe things will be done slightly later up here?
I think I've said everything that needs to be said about that. I don't know what Boris Johnson is going to announce on Sunday, so I can't make hypothetical judgments about whether I think that would be right or not for Scotland. And I will be driven by the evidence. And interestingly, if you look at the situation in England, I think rightly, that is what the government there is doing. We're having an app trialled on the Isle of Wight right now before in the rest of the country. So the Western Isles is not the same necessarily, or Shetland or Orkney, as Glasgow or Edinburgh or London. So we have to keep our minds open to the need to do things at slightly different pace, but it has to be evidence driven, and that's what I'll make sure is the case as we take these decisions. And of course, as I've said many times before, balanced against that is the need to be able to communicate simple and easy to understand messages. And from that perspective, as a politician who has to stand here and try to communicate these messages, the more consistency you've got, the easier that job is. So this is a careful balance that has to be driven by the right considerations, not by politics or a desire to do things differently or to do things the same for its own sake. Andrew Learmonth from The National.
Thanks, Mr. The paper talks about geographical variation happening in Scotland if there are certain geographies where a differential approach or different timings in the same broad approach would be appropriate. It says there would need to be an assessment of broader operational considerations, including travel restrictions. Are you able to explain a little bit about what that would mean? Are you talking about, cars not being able to get into to Aberdeen or getting up north? And would this also apply to schools? Could schools in the Western Isles or in the Highlands open up before schools in Glasgow and Edinburgh?
Look, when we set out in a paper openly that we are considering certain things, then that's what that means. We're considering. I've got a choice to make here. I can decide to say nothing until we've taken the firm decisions. Given what we're dealing with right now, then I don't think that's the right way. Or I can share openly the decision-making processes. But that means I also have to say to you, don't jump from consideration to we're definitely doing X, Y, or Z. And I know that's difficult, but I would appeal to you to try to do that or not to do that. On transport, we are considering these things, but if you recall at a very early stage of this outbreak, we asked our ferry companies not to take non-essential travel on and off the islands. So if you had, and again, this is purely hypothetical at this stage, if you had a trial of a particular approach in one of the islands, then it would make sense that you limit traffic on and off the island while you were doing that trial. Just like I think as we go into this next phase, and this is definitely a UK government responsibility, we do need to think much more about the requirements placed on people coming into the UK from other countries, whether there will be requirements to self-isolate or quarantine in any way. All of these things, as we try to suppress a virus, become really important considerations. But it is vital that we consider these things properly and fully and allow these decisions to be driven by evidence. Scott McNabb from the Scotsman.
Yeah, First Minister, you alluded to the fact that people who are home working at the moment and able to do so may be asked to continue with that for quite some time. I know you don't want to give firm dates in these things, but I'm wondering if there's any ballpark idea of how long you're looking at. Could it be even till the end of the year? And also, you mentioned the NHS XApp there that's been trialled in the Isle of Wight. What's the situation there in relation to Scotland? Because obviously the NHS 24 app was separately released up here. Could we still be using the NHS XApp?
Right, I'll come on to that point in a minute, because I think understandably there's a bit of confusion around this. So as well as I can, given these are technical matters, I want to try and address that. But on the first part of your question, I can't give dates. I wish I could. I really wish I could give you the date when I'll stand up here and say this is our final press briefing, because the crisis is over and we're all back to normal. You know and you understand I can't do that right now. But I've said when we published the paper a couple of weeks ago, what I tried to get across then, and many other leaders are trying to do the same thing, is that this is going to be a gradual process and a gradual journey back to normality as we knew it. And that's not going to happen quickly. And what we are trying to find right now is a new normal, a way we can get some kind of ordinary lives back, but not allow the virus to run out of control. And so therefore, some of the things that we're having to do right now that are different to normal, work at home where it's possible, keep 2 meters apart from each other when we're out, wear face coverings if we're in a supermarket. These are things that we cannot say for certain will not continue to be necessary up until we've got a vaccine against this virus or we've got treatments for it. So, that's the kind of ballpark, if I can give a ballpark, that we're talking about here. But we want to try and get as many of the restrictions, the most severe ones, lifted as safely and as soon as we can. On the app, the NHS X app is what's called a proximity app, and it's when I set out our test, trace, isolate approach yesterday, I talked about there being a digital part of that, which would be allow people to put their details in digitally for the contact tracing process to be more automated. But I was not talking then about that being an alternative version of the proximity app that NHS X has developed. And what I mean by a proximity app, and this is where I'm going to simplify rather than be overly technical, is if you've downloaded the app and you put into it that you've got symptoms, it will alert anybody you've been in contact with to tell them that they should be isolating, assuming that they've downloaded the app as well. Now, what I said yesterday is that I think, and other countries are using approaches like this, I think that could be a really important enhancement to how you do test, trace and isolate. But I don't think you should build a whole system on the foundation of that. I think you should build a system on more tried and tested approaches and then use that enhancement in addition to that. But I also said yesterday that for technology of that nature, if we are asking people to download it, we've got to also build people's trust in it. People have rightly these days got questions about privacy and data use. So we want to, from the Scottish Government's perspective, be much more involved in the decision making around this app so that hopefully we can allay concerns that people have and encourage them to download it. But there is some work to do before we get to that stage. Libby Brooks from The Guardian.
Hi, First Minister. The modelling in the document looks specifically at the impact of reopening nurseries and primary schools on the NHS. And I was wondering, is that because of the difficulties of getting younger children to stick to social distancing? And should parents of younger children actually be expecting to keep their kids at home potentially until September?
Look, there are different factors with children that we have to take into account. I'm going to hand over to Gregor because some of the evidence about the susceptibility of children to the virus, the way in which they shed it and share it is changing, and we've got to take that into account. We have to also think about the practicalities of younger children socially distancing, and of course what we need to do with schools is I suppose it's a bit like your drive-through coffee. You may be able to get your drive-through coffee in a completely socially distanced way, but if it's encouraging you to take a non-essential journey, potentially bringing you into contact with people along the way, then it may be having an impact beyond that. And similarly with schools, the schools themselves might be socially distanced and not impacting on the spread of the virus, but the traffic of taking kids to school and what that does in terms of overall interactions is what we have to make sure we factor into our decisions. Gregor.
I apologise for sometimes sounding like a broken record in this, but again, this is a new and emerging virus that we're learning about all the time. And way back at the beginning of the kind of outbreak, which then became the epidemic and subsequently the pandemic in China, the emerging evidence at that point was that actually it seemed that children were almost unaffected by this virus. There seemed to be very low numbers of cases of any sort of children coming through in any of the data. But over time, that international data, as we've got more and more data about this, we're learning more and more about the impact that this virus has on children and indeed on other age groups as well. And whilst we can't say with any degree of certainty what the role of children is in transmission of this virus, I think there's certainly much more understanding that this virus doesn't completely unaffect children, and that children can be carriers and potentially spread this, and sometimes can become quite severely affected, fortunately in very, very few numbers, but in certain circumstances can be quite severely affected by this virus as well. So that precautionary approach that has been taken all the way along, I think, is very, very important whilst we continue to learn exactly what the role of children and indeed all groups are in the spread of this virus.
Thanks. Kieran Andrews from the Times.
Thanks, First Minister. Following on from that point, from Wavy's point, what modelling has been done on those pupils transitioning to S1 or S3 to 6? What modelling has been done on them returning to school, given they're the pupils you're talking about going back first?
So this is the work we are doing right now, looking at different options and seeking to do modelling around those, bearing in mind that modelling will always have a degree of uncertainty in it, and some options are easier to model than others. So this is work that I'm signalling today in each of these 5 categories I ran through that we are doing now in more detail. David Ball from the Herald.
Thank you, First Minister. Can I ask how confident you are that the current restrictions are strong enough to get that R number down to the level we need it to even start looking at these options? And should that not reduce further, is it likely we could see stricter restrictions before we begin to lift the lockdown?
Look, the last thing I want to be doing is standing up here saying that we have to have stronger or more restrictive rules in place than those we have now. I've never ruled that out because it would not be right to do so. We have to be driven by what the virus is telling us is necessary. But what I do know and certainly believe really strongly is that we are making progress now. And if we keep with the rules as they are right now and not ease up in the ways that I've been talking about, then that is much, much less likely to be the case. That what we will see over the next few weeks is us carefully, gradually, and all the caveats I've put in today, but starting to ease things up. So, if we stick with it now, then we're heading in a direction of an easing, not a tightening. But if we don't stick with it now, then that's the risk that we end up having to tighten things rather than ease them up. So I come back to this point. We are at such a critical stage right now. You've heard me day after day talk about the falling numbers in ICU. Yes, it fluctuates. It's up a little bit today, but the overall trend is down. We need to keep it going down, because if it starts to go up again, then all bets are off in terms of what we might be talking about. So that's effectively, I can't do this on my own. I need all of you to help. As Gregor said, we're asking for your help. You've been fabulous, fantastic in these last few weeks. We must keep doing it because then we will, sooner rather than later, be talking about how we ease things up and not having to worry about more restrictive measures. Rachel Watson from the Mail.
First Minister, the document talks about 26,000 people being infected right now, or you believe so. Can you tell us how you get to that number? And also, if you can provide the number of how many people you believe are infected at the moment, can you provide an update on how many people you think have been infected overall?
I can't do that. I'm going to summarise, and Gregor may be able to do it a bit more technically, but that estimate of 26,000, and it is an estimate, is extrapolated from all of the data we have. So the data on new cases, on hospital admissions, on ICU admissions, on death numbers, and an estimate through complex models is built that gives us that number. I think the judgment of how many overall, I think, is a more difficult one, and that partly but not solely comes from some of the antibody testing work that is currently underway.
So I think you're right. I mean, a lot of the assumptions that we're making just now in terms of the current numbers are based on these very complex models, but we're very fortunate in having some of the kind of best modelers in the UK working on this just now. Where we will get much more information in the future is as we develop greater confidence in the kind of population antibody testing. And there's already some work underway by various units, and Scottish National Blood Transfusion Service very active in this area as well, looking to see how we can try to get a sense of what the kind of point prevalence of this infection was at any point in time in the population. And I think over the coming weeks, as we get more confidence in those tests, as we refine some of the techniques that are associated with those, working with partners and labs across the country, we'll get a much clearer sense as to what proportion of the country has been exposed to this virus and developed antibodies as a consequence of that.
Thanks. Derek Healy from the Courier.
Thank you, First Minister. Experts at Dundee University have published research which suggests a return to normal life would be almost impossible without a vaccine. Their findings show activity may have to be limited to 10% of pre-lockdown levels until that vaccine is found, and they say discussions around exit strategies around the world must move on from suggestions of rapidly returning to normal activity. What is your response to those findings, and how closely do you think they tie in with the Scottish Government's own considerations being set out today?
I've not seen the Dundee University research. I no doubt will and read it, as I'm reading a lot of this kind of research right now. But what you said to me there, I think people listening will hear is pretty much in line with what we've been saying over the piece, but also again today. This is not about flicking a switch and getting back to normal. This is about learning to live with the virus in a way that restores a degree of normality, so more normality than we've got right now, but recognises that through physical distancing, continuing to reduce our contacts with other people, things like face coverings, all of that is going to continue to be necessary up to potentially the point that we've got a vaccine. I think I said that pretty explicitly when I published a paper 2 weeks ago, and have been very clear about that today. This is about finding that way of living with the virus, but not allowing it to overwhelm us. And that is not easy, but these are the judgments that we're trying to make to find that particular formula as best we can that achieves that. Tom Martin from The Express.
Hi, good afternoon, First Minister. Just on the issue of schools, obviously a lot still to be thought out, but given the disruption and amount of time that we have seen lost or going to see lost, are we in a situation where we could possibly see some pupils having to repeat an entire academic year?
We don't want that to happen. We want to minimise the impact on young people's education, which is why we are, even before we think we can bring schools back at all, we are thinking through what the options are so that as quickly as possible we get to make the changes that take us back in the direction of normality. But I don't think I can say more helpfully today than I've said already, other than to say we will continue as this thinking and evidence and planning develops. Of course, we will continue to share that very openly. Muir Dickey from the FT.
Thank you, First Minister. You said earlier that the government has not so far been able to reduce to bring the reproduction rate for the virus in care homes below 1. How confident are you that you can stop the spread of the virus in care homes, and when do you think you might be able to bring it below R1?
I'll give you the non-expert answer and I'll hand over to Gregor. So we know that both because of the way in which this virus is affecting older people and the way it spreads within institutional settings, care homes are particularly challenging. There are similar, not identical challenges in terms of hospital transmission. So we've got, and the Health Secretary went through it yesterday, and we can go through all of this again, a number of interventions and initiatives to try firstly to keep it out of care homes, but then to make sure that we are limiting any spread within care homes as far as possible. And that is right now such an important focus, not just of the Scottish Government, but of health boards, care home providers and all of our partners as we try to work in that fully joined up way. Gregor.
So again, we know from not only our own experience, but experience from around about the world, that the most challenging environment to tackle this virus is in any enclosed space, any enclosed environment. I've said before that this virus loves institutions, and if you have an institution that's full of very vulnerable people, I'm afraid this virus can sometimes be very, very difficult to try to control. That is why the directors of public health are taking the actions that they're taking just now to go beyond how we would normally manage outbreaks, but to enhance that even further so that they are intervening at an even earlier stage to try to bring those routes of transmission that we've spoken about under control as quickly as possible. That, coupled with the guidance that's been in place since the early part of March around about making sure that residents in these homes are adequately social distanced, that they're not getting the opportunities to mix and therefore to spread that virus as well, should all make it that we begin to see this R number coming under control within the care home environment. But as I say, I think it has to be said that this is a very, very difficult environment for that to take place.
Thank you. And the last question today is Vivian Aitken from the Daily Record.
Good afternoon, First Minister. Just on the subject of getting back to schools, I was wondering, it's probably going to be a very difficult thing to get children to properly socially distance from each other, given the nature of children and wanting to interact with each other. Will it be a requirement for children and for teachers to wear face coverings if they go back to school?
Look, I'm not going to say any more than I've already said. I think I've gone as far as I can today in terms of what we are considering, and we'll continue to consider all of these things. I think when we made the announcement around face coverings a week ago, we recognised then that while we were only saying we specifically didn't recommend it for under 2s, it's always going to be more difficult to ask children to do things like that. So I think we've got to be realistic about some of this. But that just underlines the complexity of the decisions that we are going to be taking over the days and weeks to come. Look, can I draw this to a close as we have gone through all of the questions, and my thanks to the journalists, my thanks to Gregor and to Anna, our sign language interpreter, who has been helping us make sure this is accessible today. Can I say thank you to all of you, though, not just for joining us today and listening to this latest assessment, but also for bearing with us through this. I know that every day when I stand up here and say no change now, your hearts must sink. Please believe me when I say I will only stand here and ask you to comply with these restrictions for as long as I think this is necessary. When I look at all of the evidence before us right now, and we've summarised it in the paper we've published today, it tells me two things: that we are making real progress and we are definitely going in the right direction. But secondly, it would be so easy to allow it to slip back. And that's why I say again, we are at such a critical juncture in this. So if we keep doing what we're doing, if we all maybe tighten up a little bit, if we've been easing up in our compliance with these restrictions, then I am confident that we will keep making that progress. And it won't be too long before I'm standing here, not announcing a complete return to normality, but announcing the start of that gradual journey back to something that feels more normal than our lives do right now. So again, this is will only work if it's a partnership. I share as much as I can of the evidence with you, ask you to do the things that we judge are necessary, but you then agreeing to do them. You've been doing that splendidly so far, and I ask you to continue so that we can much more quickly get to a point where we're starting to ease up some of these restrictions that we all hate so much. So thank you very much indeed. Tomorrow, we have a slightly different format. We will be joining you at the same time tomorrow, but we will be joining you. I will be joining you from the Scottish Parliament at 12:30 tomorrow. There is an hour-long session of First Minister's questions, where I'll be taking questions from party opposition leaders rather than from journalists. But I'll be giving you the same update on the figures as I do every day, and we'll be back here as normal on Thursday. Thank you very much indeed.